So next we're going to hear from our Healthy Weight and Treating Obesity team within the integrated care system. And as you can imagine, a huge amount of work has gone on already. I'm sure that many of you will have worked with our teams to form the draft position of our strategy for this area. And I'm absolutely delighted to welcome up next Dr. Arut Vijayaraman. I'm hoping he wouldn't tell me how to pronounce his name, so I had to have a go at it. Anna Pickford and Will Smith, who are going to be taking you through the strategy and how you can get involved in that and feedback to them throughout the course of today as well. That one's forward, that one's back. Thank you very much. If we can give them a warm welcome, everybody. Thank you.
Good morning. Thank you for calling my name right. Well done. Let me start with thanking the organizers. I know a few people like Karen Kirk and Tracy have been working on this for last few months. I can't see them here, but well done. It's a great crowd here, and thanks for giving us this platform to talk about what we are going to talk about as well. When I was introduced as a person working with the ICB, which I am, but most importantly, I'm here as a champion for people with excess weight. I'm here as a champion for people who are suffering the most stigma, most difficulties, and most infliction on their all aspects of health, their mental, physical, and social well-being affected more than any other disease you know of. I have been helping these people as a clinician for the last 15 years, and I have spoken to at least 10,000 people with weight-related problems. And each time I finish a clinic, I see people crying in the clinic, and I have me and my staff crying at the end of the clinic. And that's the difficulties you hear from them. As Nicola just explained elegantly, it is extremely hard for these people to face. The social difficulties they face are enormous, you won't even imagine. I see a father who says, my daughter says, don't come with me to the school because her friends pick on her because her father is fat. That's what the other children call. And think about the child who is overweight. That's the problem they are facing, and they don't get the help they need yet in this time. And so we are in a very important period of time, and you have a very important responsibility in your hand. You have seen what everybody has seen, but time to think what nobody has thought. And that's what my team is here about. I see a lot of passionate people here, people like Mark Burns, Amanda Peacock, the people who are helping children with excess weight problems, people like Lisa Harson, who is helping the mental health. And I also see people like Will Smith, is a manager, not a clinician, but he has done more impactful work for people with weight-related problems than I have done in 15 years. So I'm just telling you, every one of you can do something different. Time is gone where we thought it's just a lifestyle choice. I usually ask a question with the people, how many of you think it's a lifestyle choice? I dared to do that after Nicola's talk. I don't think any one of you will raise your hand. But believe me, a lot of clinicians think like that, even today. And that's the reality. And we need to change that. If somebody comes to you with depression, do you tell them, go home and be happy, all your problems will be solved? Do you tell them that? If somebody falls on a skiing and break their elbow, do you tell them, it's your responsibility, you did it to yourself, get out? Do you tell them that? But you tell that to people with weight problems every single day. The person who walks into the orthopedic clinician's room, limping all the way, gets told, go and sort your weight, you'll be fine. Fortunately, I work in an ICB where people think differently. We got leaders like Neil O'Brien, Ewan Mall, Craig Blundred, Arwon Shivan, who thinks completely differently. They have seen what everybody has seen, but they are thinking no one has thought. And that's what I think is going to make a difference. We need more passionate people, and I see a lot of passionate people here, but we also need finances. That's why we need people like Shubhan. Passionate people, please find us and talk to us. Will and I will go, beg, borrow. No, we won't steal, but we are good at begging, and we will get that to you to bring passion into practice. So with that, I'm going to hand over to my team, and they'll talk to you about what the ICB has been doing for the last 2.5 years, 3 years, which no ICB has ever done. We go around all over the country. Will and I have met with multiple ICBs. I'm saying this from the bottom of my heart, that this ICB is doing wonderful things for people with weight-related problems. And let's all join together with the ICB to do more. Thank you, everyone. On to Anna.
Hi, everyone. So I'm going to talk through data, but probably in a less articulate way than Nicola did previously. But what you will find is there's a lot of crossover. We have, over the last 2.5 years, before starting any of the work, we wanted to establish a baseline position. What is the scale of the challenge within the North East? When we first started out, we couldn't even get a definitive understanding of what the prevalence of increased weight and obesity was within the North East and North Cumbria. So we started out by doing needs assessments, which is a very data-driven process usually. But we were lucky enough to work as a system, and we had a lot of different partners and stakeholders involved in creating these needs assessments. I'm going to talk the boring bit, which is just data and figures, but we will go through, and some of these numbers might be interesting, shocking, or maybe if you work in the area, it might not be a shock at all. So we'll start with the Children and Young Persons Needs Assessment, which actually we're launching today. It is up on the website, shameless plug there, and we will be handing out QR codes to people who want to look at it and read it in its entirety. So some of the facts. Between 42% and 54% of children in the North East and North Cumbria were reported as physically active. And that's a reducing trend, particularly in secondary school children. We've seen a similar picture with adults, that physical activity is reducing. We've got 12% of women reported in our North East and North Cumbria region as smoking at time of delivery, compared to 9% in England. And if we think of the risks and the hazard risks that Nicola presented before, this is already establishing a greater risk for the children, young people and the mothers within the region. We've got variation by deprivation. We've got, based on separate data, so if you're questioning why I've got 40% and Nicola had less, we've got 45% of maternal bookings that are reported in the data that identify the mother as having a BMI of over 30. We've also got issues with from people with lived experience around bullying, low self-esteem, increased risk of school absences. So it's not just about the physical health of these children, it's also about their future prospects, their educational needs and their wider social impact. I'll not spend too much time on the adult healthcare needs assessment, but what we found is there was a lot of crossover. But we've got 725,000, approximately, adults within the North East and North Cumbria who have a BMI greater than 30. That is an absolutely astounding number when we think we've got 3.1 million people living in the North East. We've got a disproportionate amount of those individuals that are living within the most deprived communities of our region. And we've got 80,000 who have 4 or more long-term conditions already diagnosed within clinical practice. Some of those conditions included anxiety and depression. And actually, when we started this work, we identified the most prevalent comorbidity to be reported is anxiety and depression. Again, making that link back with other conditions outside of physical health. And within the physical health, we've got hypertension and type 2 diabetes up there as well. So rather than just looking at facts and figures as an ICB, I thought I would try and present it in a slightly different way. And if these figures were applied at a community level, what would that look like? So we've taken an actual community within the North East and North Cumbria, and we've reported the figures for this particular area. It's a real area, but we're going to keep it anonymous. So within this area, we've got about 7,500 people living within this community. A third of the reception-age children within this neighbourhood, within this community, are reported as living with obesity, and over a quarter are living with severe obesity. Almost half the year 6 primary school children are reported as living with obesity, and over a quarter are living with severe obesity. And a third of the adults, so the parents, the relatives, the neighbours of the children mentioned, are also, they have a BMI greater than 30, and 6.4% have a BMI greater than 40. We've got 46% of the babies receiving breast as their first feed, and thinking about that correlation with the longer that a child is breastfed, the reducing risk of developing obesity in later life. We've already got 54% of babies who are not actually even receiving breastfeeding from day one. And we've got nearly 13% of the mothers still smoking at time of delivery. We've got a community that is experiencing high levels of poverty. They are within the most deprived 20% nationally, and 35% of the working age people in this community are claiming benefits. We've got children and young people, 35% of them are living in what's described as absolute low-income families, so very low levels of disposable income available within those households. Access to green space, areas for the children to play, it's actually further away than what the North East average is for this particular community. And half the children are identified within data as physically inactive, which is classified as 60 minutes per week of exercise and activity. We've got lots of supermarkets in this very small area, and a lot of them are known to retail high-fat, high-sugar foods rather than a vast array of other nutritious food. And there's actually 3 fast food takeaway areas. We've only got 7,500 people in this area, very small community, and there's 3 takeaways in that area. And 55% of the adults who have a BMI of over 30 already have at least one other health condition. So we're talking about an increased weight, as well as hypertension, diabetes, anxiety and depression. So there's a lot going on with the people within this community. So you can see I've put boxes around these, and the boxes, if it's shown correctly on the screen, the ones that look dotted are the ones where these people are having contacts with healthcare services. So if you think about it in terms of just healthcare, then there are opportunities to make every contact count and link. The other box is a wider system, which links in with that whole system approach. So what does that mean in terms of numbers? We've got 60 children in a small community who are living with obesity. We've got 88 year 6 children who are living with obesity. We've got 2,000 adults who have a BMI of over 30, and 384 who have a BMI greater than 40 and probably meeting those thresholds for specialist weight management treatment. We've got 1,300 plus individuals who are claiming benefits and out of work. We've got 525 children living in poverty. And we've got 750 children who are not meeting that recommended weekly activity level. And then finally, with those additional comorbidities and additional needs, we've got over 1,000 people who have multiple complex needs already. So I will hand over to Will now. I've bombarded you with facts and figures.
Thank you, Anna. Probably agree with me, those figures are both startling but fascinating at the same time as well, and clearly sets the picture. Have we got the video of Ewan to play? Ah, there we go. Perfect.
Hello, everyone, and sorry for not being able to be there with you today. My name is Ewan Moll. I'm Clinical Director for North East and North Cumbria Integrated Care Board, and I'm the lead for the Healthy Weight and Treating Obesity programme. Now, Healthy weight and treating obesity is obviously a growing agenda, a growing problem for our population, and there's lots of work going on, so I'm sure you're going to have lots of very productive conversations there today. One of the things you're going to be hearing about is the development of our strategy, our system-wide strategy on healthy weight and treating obesity. Now that's going to have lots of different aspects to it, which you'll hear more about in detail, and is heavily based upon what we know about our population and the challenges facing us. So we've taken into consideration things like the food environment, we've taken into account the use of ultra-processed foods, and also the provision of both NHS and local authority commissioned services to support people who are living with healthy weight and obesity. So the strategy is really the first draft. You'll hear the first presentation of it today, and we're really keen to hear people's views on it. I think there are 4 themes that will talk you through. But what we know is that this is really a golden thread that runs through everything we do. People will have heard lots of talk recently about the importance of prevention and the challenges facing our population. And we know that obesity is one of the biggest problems facing our population. By 2035, it's forecast to be the leading cause of cancer in women in our population. So we know that there's a huge amount of work to be done on it. So we're looking at how we can change the food environment, how we can use the NHS position and the local authority position to lobby and advocate for better regulation on foods. But the other thing we need to do is make sure that our services are fit for purpose as well. So we're looking at how we expand services, improve access to our services, adopt all of the latest technologies into those services to ensure that our population are living the longest and healthiest lives that they can do. So once again, apologies for not being there. I look forward to hearing about the event. I'm sure you'll all have a great time, and you'll now hear from Will, who's going to present the strategy.
That worked better than I anticipated. So just onto the strategy, I won't labour this too much, but you've probably all seen this just in terms of what the impact and the cost is of obesity. Those figures are probably out of date now in terms of the potentially that's doubled, maybe even trebled as well. So we know it's an impact on the system, and it's something that we need to look at and work together to tackle this as a system, not as individuals. Just want to use this on, this is one of our slides, but if you just look into it, so just see the little sign, Diabetes Care Centre, where we're supposed to be treating and helping people, but there we go, there's a proliferation of high fat and high sugar drinks and food accessible as you walk in and out, so not really ideal. Just want to point out they have been removed by the fantastic work of Arrett as well. Again, some of these comments might be a little bit triggering, but we did some behavioural insights work just to get better understanding in terms of the levers and the barriers and enablers around weight management. And some of the people just sort of gave us insight in terms of they didn't want to bother the NHS, in terms of they didn't think weight was an important problem, in terms of sometimes they got less than empathetic and obviously a stigmatised kind of point of view. And then on the flip side of our healthcare professionals were telling us that it was a bit of a struggle within 10 minutes to have a meaningful conversation about it. Did they have the necessary training? Were they comfortable doing so? And what options did they have to actually send them to? And what information could they signpost them to as well? You'll all have seen this, but I just wanted to kind of put it up for the purpose of, in the last 30 years, we've had 13 plus kind of policies and procedures around diet, physical activity and living with obesity. And yet the prevalence for adults and children still continues to rise. It's obviously not impactful and successful. So what's different this time? Well, we've got something that's come that is a benefit, but also it creates something that we need to think about and how we do it and how we utilise it as well. So we've got 3 obesity drugs on the market at the moment, and there's another 120 plus in development. It is coming at us like a juggernaut, and we've got to be prepared for this. So the NHS, we're mandated to implement these and make them available, but we want to do it efficiently, effectively, morally and ethically as well, and get it to the people who need it most. However, we can't treat our way out of this. We need to look at prevention as well. We need to turn off that tap as well and support people. So just a little bit of the current context. I'll run through it fairly quickly. But obesity in terms of childhood, obesity is a crucial part of our clinical strategy. We acknowledge a long-term whole system approach is needed. We can't solve this in 2 or 3 years. It's got to be longer term. In terms of the work as well, is that we're doing it on the best possible evidence, and that's a growing evidence base, and we're hoping to contribute to it as well. In terms of the primacy of places, there's work going on in local delivery teams. We want to complement that and stuff that we can build on and deliver at pace and at scale across the whole ICB as well. What we've got to do is we've got to address the inequity of access to service provision as well. We've got to think about in terms of what we've got available, both financial and human resources-wise, to deliver this, and that it's going to take a huge cultural shift, and we've got to do this together as well. So how did we get here? Aaron and I started this process back in 2021. Initially, it was just about restarting services post-COVID and launching the digital weight management program. And then we were hoping to get central funding. Unfortunately, that got pulled. So Aaron and I were very creative in terms of we developed regional standards. We made a plea and were successful in earning £1 million to do minimum standard services across the region. We further did the healthcare needs assessment, which Anna did. It was absolutely fantastic, that framed the extent of the problem. In early 2024, we were tasked in terms of, can we look at prevention and develop a strategy that looks at this as well. And in April 2024, we had a stakeholder engagement event. We brought everyone across the region to discuss healthy weight and treating obesity and what we could do about it, and to help us to come up with themes and how we could approach this and tackle this strategically across the region. So on the basis of that, we analysed the stakeholder engagement and came up with 4 themes. And the 4 themes were based on data and the intelligence and what came out of it. And what we did is pull together what we thought was 4 key themes that would help us to tackle healthy weight and treating obesity. And we want to develop a vision as well. And our vision is we want to be patient-centric, not weight-centric. We want to end weight stigma. We wanted to make sure that we had equity of access to services as well. We want to make sure we had a whole systems approach and that we have comms and engagement. We want to bring people on this journey with us. We want to engage with them, lived experience, and that we get the messages right as well and be non-stigmatising, and that the strategy will have an annual action plan that we'll build on. So just onto the themes, as articulated a couple of times, we want to take a whole system approach, and that's engaging with multiple stakeholders across our system and linking in with work that's already gone on in the local authorities. And that will have a logic model that will help us to build our strategies and priorities. And we would love your feedback and support into that in terms of what's going on in your local area and how we can build that as well. This one we really like as well in terms of the advocacy around the food environment and the commercial determinants. We did a seminar on commercial determinants. If you're lucky enough to listen to it, it would make you very, very angry in terms of the tactics that the food industry used to dupe us and trick us into saying things that are healthy and unhealthy, and it's not good. So what we're hoping to do is have an advocacy and a framework and bring people on this journey with us, both professionals and the public as well. And then theme 3 is service provision, which is crucial. We need to provide services, help those who need help, but we need to do it for those who are most in need in terms of key populations who predominantly don't get access to it. Looking at those with like LD, SMI from the most deprived areas as well, multiple comorbidities, and looking at those in a holistic way and how we can approach it. Another element that we want to do was getting this right as well, that we have a pathway that flows from primary prevention right through to bariatric surgery. So we're tackling this earlier. We're not just waiting to the point where there's comorbidities or someone's really, really struggling before we offer help. We have meaningful conversations, offer support, and do it in an empathetic way. And what we need to do is looking at securing the services for both children and maternity services as well, particularly building on some of the work that Nicola was talking about, which is fantastic. And then theme 4 is workforce. So what we want to do is make sure that we educate and support our current and future workforce as well, making sure that we've got the skills and the tools and the knowledge to be able to engage with our patient population as well. We also want to support our health and well-being of our current workforce as well, which is important. We need to be healthy and support those as well. And one of the things that we've developed is we've got our School of Healthy Weight and Treating Obesity studies as well, which is Boo's come and talked to us about that. We've got a couple of modules up already, and we're getting new content on a monthly basis as well. And then in terms of what we want to do is having a consistent approach to our messaging for both staff and for the public as well. Our enablers is we need comms and engagement. It needs to be sensitive. It needs to be worded correctly, and we want to bring people along on this journey with us as well. Data intelligence, we've got Anna, she's absolutely fantastic and she's great at bringing the data to life as well. We coined the phrases that people become percentage blind. We want to actually bring real numbers to you to make it more impactful and meaningful. One of the things we've got as well as a healthy weight and treating obesity data dashboard that gives you great insight in terms of what's going on in your area. You can break it down to deprivation in terms of comorbidities. It is amazing, and we'll give you the link to that. Please have a look at it as well. And we want to collect more qualitative data as well. So, what I would like to do, there's a QR code there as well. And just love you if you'd take a copy of that and give some feedback on this as well. And I would just like to say thank you for taking the time to listen to us. Anna and I will be hanging around the booth stand if you want to come and talk to us. And we've got some QR codes for the downloads for healthcare needs assessment and for some of the feedback on our strategic themes and priorities. So thank you very much. Thank you.